He was just 5 when he was sexually and physically abused. She was just 3 years old when her father threw her down the stairs, which made her permanently disabled. Imagine being a child who fears his own parents, being a child who has to face her abuser every single day, being a child who cannot even burst into tears because of the fear of getting beaten up, a child who has no one to share her thoughts with. We always hear such incidents about crimes against children which are widely reported in our media. The word abuse will usually channel our thoughts to abuse against the female gender, but the fact is 1 out of 3 girls and 1 out of 5 boys are subjected to sexual abuse before they reach age 18, and approximately 5 children die every day because of the consequence of child abuse. An 2018 study revealed that 76% of child abuse culprits were a parent to the victim. 62% of children placed in foster care was removed due to abusive neglect. Child abuse is defined as any intentional harm or mistreatment to a child under 18 years is considered a child abuse. Child abuse takes many forms. Physical abuse, when the child is purposefully physically injured. Sexual abuse is a sexual activity with a child. Emotional abuse or psychological abuse, injuring a child's self-esteem or emotional well-being. Medical abuse, giving a false information about an illness in a child that requires medical attention. Neglect, failure to provide even basic facilities such as food, shelter, education, etc. to a child. Some children may be able to overcome the physical and psychological effects of child abuse, while others may result in physical, behavioral, emotional, or mental health issues. Physical issues include premature death, physical disabilities, learning disabilities, substance abuse, health problems such as heart disease, immune disorder, chronic lung disease, and cancer. Behavioral issues include violent behavior, abuse of others, withdrawal, suicide attempts or self-injury, high-risk sexual behaviors, problems in school, limited social and relationship skills, problems with work or staying employed. Emotional issues include low self-esteem, difficulty establishing or maintaining relationship, challenges with intimacy and trust, an unhealthy view of parenthood, inability to cope with stress and frustration, and acceptance that violence is normal part of a relation. Mental health disorders, eating disorders, personality disorders, behavior disorders, depression, anxiety disorders, PTSD, sleep disorders. In a study, it was revealed that girls tend to express internalizing behaviors such as depression, social withdrawal, anxiety, while boys tend to express externalizing behaviors such as bullying, aggression, and hostility. Bruising and burning is the most common form of physical abuse, but can be missed especially in children who can walk. Looking out for bruises or burns in areas like the face and head can give indications of abuse. Abdominal trauma is an injury to the abdomen. It is the second most common cause of death, mostly seen in infants and toddlers. Many children will not display any abdominal bruising, so screening should include liver function test, amylase, lipase, and testing for hematuria. Sexual abuse. If the child demonstrates behaviors such as undressing in front of others, touching others' genitals, as well as trying to look at others undressing, may be a concern for sexual abuse. General examination for neglect includes poor oral hygiene, malnutrition with significant growth failure, untreated diaper dermatitis, or untreated wounds. Any child younger than 2 years old for whom there is a concern of physical abuse must undergo a skeletal survey and a laboratory evaluation. The treatment for child abuse and neglect depends on the type of abuse. The first priority is creating a safe environment for the child. Once the child is safe, mental health professionals or physicians will figure out the best type of therapy. Therapy can help children understand their thoughts and feelings so they can learn to cope with the aftermath of abuse. Developmental therapy. This type of therapy deals with the way a child grows and the way that growth has been changed or blocked by the abuse. Intrapersonal therapy. This type of therapy deals with the way the child's relationships have been influenced by the abuse. Cognitive and behavioral therapy. This type of therapy deals with the way the abused child's feelings and thoughts have changed their behavior. Treatment activities may also focus on preventing child abuse and neglect from happening again.